Hi, my name is Larissa Grigaitis, and I'm going to be talking today about the effects of exercise on stress and anxiety. Stress and anxiety are both the body's reaction to changes that require adjustments because the body senses a threat. These can be changes that are physical, mental, or emotional. Too much stress can lead to anxiety, and it's usually for more than 6 months, and they both evoke the flight or fight response. The fight or flight response is when the eyes and your senses sense danger, and this is done by the amygdala, which is known for your emotional processing. This sends a danger signal to your hypothalamus, which is the command center for the rest of the body. This activates the sympathetic nervous system and communicates with the autonomic nervous system to your adrenal glands. Your adrenal glands control your breathing, your heart rate by releasing adrenaline and epinephrine into your bloodstream. Epinephrine causes all of these to increase, and it opens your airways to your lungs, which makes your senses more sharpened because it sends more oxygen to your brain. Your amygdala and hypothalamus are able to do all this without you even knowing it. That's why maybe if you're about to get hit by a car, you can jump out of the way fast. After epinephrine is used up, the hypothalamus triggers HPA axis. Your HPA axis is your hypothalamus, pituitary gland, and adrenal gland. It relies on hormones to keep your sympathetic nervous system going. If danger is still present, the hypothalamus will keep release hormones to the adrenal gland, which releases ACTH, then releases cortisol. The body stays on high alert until the cortisol goes back down due to the threat passing, and it'll all go back down due to the parasympathetic nervous system. Exercise response. The exercise forces your body systems to all communicate closer together. Your cardiovascular, renal, muscular, your nervous systems will all work more efficiently due to the stress and be able to handle the stress more efficiently. Those who participate in moderate intensity have half the stress as compared to those people that don't. Moving will decrease your muscle tension, decrease how much your body makes you feel anxious. Exercising will increase your anti-anxiety neurochemicals, and it'll activate the frontal regions of your brain, which control the amygdala, and the amygdala is what reacts to threats. Exercise is known to decrease anxiety and stress for 5 theories. Thermogenics, which warms the brainstem, which can relax the body. Endorphins are released more, which are correlated with a positive mood and an overall well-being. Monomin is which increases the availability of your neurotransmitters, which allows more endorphins to be released. Distraction takes the mind off of your worries. When you're going on a run, you're going to be focused on going on the run and not what you have to do when you get home. And self-efficacy, which changes how your goals, tasks, and challenges are approached. Exercise releases endorphins, which helps relieve stress and anxiety. Endorphins are a kind of neurotransmitter, and neurotransmitters are brain chemicals that send electrical signals throughout your body. Endorphins are created in the hypothalamus, released by the pituitary gland, and sent throughout the nervous system. Stress and pain will release will release endorphins, and this will decrease your pain and increase your euphoria. Endorphins react with your opiate receptors to reduce how we perceive pain. Endorphins are usually released by prolonged continuous exercise, and depending on person to person, one person can release more than another. This is a photo of 2 brains, one after sitting quietly and one after a 20-minute walk. You can tell that the brain after the 20-minute walk has more red and yellow areas that indicate more endorphins are being released. Your mood is going to elevate and your anxiety is going to reduce after exercise due to releasing and binding B endorphins to the receptors. Exercise increases B endorphins in the central and peripheral nervous system, and abnormal levels of these B endorphins are linked to anxiety. How being stressed out can affect exercise. It will increase your muscle tension, which has a negative effect on your motor control and will increase injury. It'll hinder your concentration. If you're playing sports, you're running on a bumpy trail, you need to be focused or you're going to get injured. It can affect your vision due to high levels of stress hormone being released, and it's going to blur your vision and disrupt your hand-eye coordination, hinder progress. It'll make it harder to lose weight because cortisol makes you gain weight in your midsection, and stress causes you to increase your appetite, and it's a demotivator because if you're stressed and anxious, you're not going to want to go to the gym. Causes of stress and anxiety could be at work, school, and relationships. Right now, I'm stressed out with how I'm going to pay rent, all the deadlines I have to get done for school and applying to graduate schools. Could be due to emotional trauma, medical illnesses, such as having to worry about your diabetes, side effect of medication, symptoms of medical illnesses, and the lack of oxygen to your brain. Too much of worrying about stress and anxiety can lead to cardiovascular risks, such as using alcohol, smoking, your diet, and your physical activity. Anxiety is the most common mental illness in the world. 40 million adults in the U.S. face it every year, which is 18% face it every year. 40 million adults in the U.S. face it, 18% face it every year. Women are twice as likely to be affected than men, and 25% of children aged 13 to 18 face anxiety. People who are likely to be under stress are military spouses, cancer survivors, low-income families, first-time mothers, medical school students, and caregivers. These are two surveys done. One is the annual Gallup poll of 150,000 people. So you can tell in the past 9 years, from 2009 to 2018, anger, worry, and stress haven't deviated that much. People are angry and worried, but they're about 50% of 150,000 people are stressed out, which is significant. There is also another study done that asked adults and teens 3 questions after working out: if they felt good about themselves, if they were in a good mood, or if they were less stressed after working out. 50% of adults and teens said they felt good about themselves, about 37% said they were in a good mood after working out, and about 31% said that they were less stressed after working out. So obviously working out is going to make you feel better about yourself. There are symptoms for stress and anxiety. These could be cognitive, problems with memory, concentrating, judgment, worry; emotional, problems with depression, you're agitated, moody, overwhelmed, lonely; physical, such as pain, diarrhea, dizziness, high heart rate, weakened immune system; and behavioral, such as eating, sleeping, isolation, procrastinating, drugs, and nervous habits. Anxiety is diagnosed by the DSM-5, which professionals ask people about in their open-ended questions. Some of the criteria is being anxious for more than 6 months, a lot of worry, and having 3 symptoms out of the 6, such as restlessness, easily fatigued, difficulty concentrating, irritability, muscle tension, and sleep disturbance. Anxiety and worry can cause your social life and your occupation to fail. There's no specific test for stress, but doctors will often check urine, blood, and family history to rule out any medical causes and make sure that the person's actually stressed out. Treatment for anxiety is psychotherapy. You could talk to someone. Cognitive behavioral therapy, which helps you learn skills to target triggers. If your mom makes you stressed out, maybe you can learn ways to handle it. Medication such as antidepressant and changing your life, eating better, exercising more, and maybe sleeping more. Stress can be treated by deep breathing, practicing mindfulness, and of course, exercise. A lot of patients that have anxiety are on antidepressants and antipsychotics. Antidepressants can cause fatigue, dizziness, and weight gain. So when working with these patients, you shouldn't put them on a normal bike and give them free weights. Maybe start with machines and stationary bikes so they're not going to become injured. Antipsychotic medicine can cause dehydration and gait problems, so that should also be in the back of your head when working with them too. Special considerations include setting small goals. People with anxiety are anxious, so if you're reaching just 5 minutes a day, they're going to be excited that they actually reached their goal, and they're going to continue to exercise. Working out, you just need to be consistent, no matter if it's 5 to 50 minutes a day. If they're inactive, maybe start 2 to 3 sessions a week instead of 5 to 7. Know if your client's an introvert or extrovert. They're an introvert, they're not going to want to attend group classes, but maybe they will go for a run while listening to music with a close friend because that could decrease how they feel about it. So my case study is female. She's 22 years old, no exercise experience. She has a resting heart rate of 90, BMI of 30. Her blood pressure is 139/89, and her max exercise heart rate is 185. Her BMI has increased in the last 6 months due to being restless, easily fatigued, irritable, not sleeping, and feeling sad. The stress of her new job she got over a year ago caused her to take up smoking, remain sedentary, and form hypertension. She has anxiety and is currently on antidepressants and wants to try and decrease her weight and manage her stress. She tried exercise prior, but she was under too much pain and stress from her trainer. These results show that she has cardiovascular disease risks, she's obese, she has stage 1 hypertension, she's a smoker and sedentary. A physician should do a preliminary exam to clear her. This could be done with a 12-lead ECG, carotid ultrasound, blood chemistry panel. And she's also on anxiety medication that can cause fatigue, dizziness, and weight gain. So she should definitely not be using free weights or anything that's not stationary when they put her on a treadmill or a normal bike. Considerations: I would always be aware of the community and emergency resources for her. She should be involved in planning exactly what she wants to do. If she does not like aerobics, then I would work around it, maybe do 10 minutes of aerobics and a half hour of resistance training. I want her to participate in at least 10 minutes of aerobics daily. Pain is never done for people with anxiety, so I want to decrease pain as much as possible. And I would also tell her not to hold her breath while lifting due to changes in blood pressure. Don't want her to pass out, and have an abnormal heart rhythm, high blood pressure. She has a high resting heart rate, so I would maybe check her halfway through exercising to make sure that everything's okay. Her exercise prescription: I would have her warm up and cool down 5 minutes before and after exercise at a low intensity. Maybe do brisk walks with weights. For aerobics, I would have her do 3 to 5 days a week, 50 to 75% of her heart rate reserve, 30 minutes, maybe try to progress to 50, but we are going to figure this out by talking initially. And maybe for this, I'd have her jog, do stationary bike, dance, water aerobics. Resistance, I would have her do 2 to 3 days a week, moderate intensity, RPE of 11 to 15, 10 exercises, 3 sets, 10 reps. Machines, resistant bands, body weights, no free weights at first. Flexibility, I would have her do 2 to 3 days a week, mild tension, maybe 10 minutes of yoga and Tai Chi. And if she wants to do static and dynamic stretching, I would have her do 3 reps of each and hold each for 10 to 30 seconds. Yoga is considered something that helps your mind and body come together and does reduce anxiety. So maybe if she wants to do her whole workout on yoga, I would incorporate aerobics and resistance training into her yoga practice. Conclusion: anxiety is crippling stress for 6 months. Everyday causes of stress in our life. Anxiety and stress is very prevalent. Symptoms can be cognitive, emotional, physical, or behavioral. Stress has no specific test, but anxiety can be tested by the DSM-5. Exercise releases endorphins, which helps relieve stress and anxiety, and it releases B endorphins, and a lack of this is shown in people with anxiety. Causes of flight or fight reaction when you're stressed out. Antidepressants can cause fatigue, dizziness, and weight gain. Exercise decreases anxiety and stress by thermogenetics, endorphins, monoamine, distraction, and self-efficacy. Clients with anxiety need extra support and considerations, and definitely encourage exercise and don't cause them any more pain. Thank you for listening.